beautiful people. Welcome to Homeopathy Medicines. What potency should you take? A key element in treating successfully with homeopathy is selecting the right remedy. It is best to familiarization yourself with homeopathic remedies before you need them so you can have a vague idea in mind of what remedy may be called for. Homeopathic remedies promote a return to normal body function, and can be of help in almost any physical symptom or condition. Though they work on a subtle level, they ultimately affect the chemical, cellular, and structural health of the organism. Homeopathy can be safely used to treat anyone in part because it is given in such minute doses. Pregnant women, newborn babies, children and weak or elderly people may all use the appropriate dosages of homeopathic remedies without dangerous side effects. First, what is potency? The gist of potency lies in homeopathy's principle of the minimum dose. In short, while searching for a safe dose, homeopathy's founding father, Dr. Samuel Hahnemann, realized that in infinitesimally small doses, properly diluted, the healing properties of the source substance were not only present, but stronger. His system of dilution requires a series of strong succussive actions on each dilution. He compared this dynamizing succussion process to that of pounding an iron rod to make a magnet. Thus, in his search for a way to do no harm, Hahnemann established potency and the principle of the minimum dose. Next step: high versus slow and X versus C. X and C, the potency of a remedy is the number of times it has been diluted and homeopathically processed. X potencies are diluted on a scale of 1/10, 1 part to 10, C potencies 1 to 100, 1 part to 100. The Homeopathic Pharmacopoeia of the United States, PUS, defines the exact standards, tests and guidelines for each remedy. In the low range, we offer many Highlands singles in 6x and 30x, in the higher range, we offer these and more singles by Boericke in 30C and 200C. Which is stronger, 6x or 30x? Less is more in homeopathy. 30x and 30C are more dilute, but also more potent and therefore deeper acting than 6x. The benefit of 6x is that it requires less precision in selection and can be ideal for light, repeatable dosing. Which potency? Adults and children who will use the product daily, as a complementary treatment for a chronic condition, try 12, 15 or 30 ch. Adults who intend to take only 1 or 2 doses, as desired, try 30 or 200 ch. Children who intend to take only 1 or 2 doses, as desired, try 30 ch. Adults or children, or pets, where frequent dosing is desired, or where acute situations arise with frequency, such as bug bites, stress or anxiety, try 5 ch, 6 ch, 7 ch, or 12 ch, or any of the mid to low DH potencies. The idea that a remedy is stronger the higher its dilution, is confusing at best. For starters, here are some basic tenets you can follow. 1. In general, start low, 6x and 30x, so you can go higher, 30x, 30C, 200C, clearing symptoms as potency increases. 2. Selection. Lower potencies cover a wider range of symptoms, so are ideal if you are not certain that you have chosen the best remedy for your symptoms. Higher potencies need more accurate selection to stimulate cure. For example, pulsatilla colds and aconite colds are very similar, but if you take aconite 30C, you might not touch a pulsatilla cold. However, a dose or 2 of 6x might have enough of the right energy to stimulate relief. 3. Severity. The more severe or sudden the symptoms, the higher the potency you might want to use. For example, a sudden belladonna minor fever with red face and radiating heat, responds faster to a 30x or 30C, but if a 6x is what you have available, use it. You typically repeat more often for lower potency doses. 4. Frequency. The higher the potency, the less often you need to dose. It is always best to stop or reduce dosing when symptoms improve. If improvement slows or stops, you can redose with the same or next potency, or move to whatever remedy is indicated if symptoms have changed. Things to know: healing aggravations. If a remedy stimulates cure, there is often some cleansing or clearing to do along the way. A sinus infection has a lot of mucus to clear. Existing acne runs its course as the body finds better ways of clearing pus. Emotional issues find resolve by stirring things up a bit sometimes. Low potencies. These include 6x and sometimes 30x. They are less likely to stimulate a strong healing aggravation. High potencies. These include 30x, 30C and 200C and higher. They require more precise selection and, if well chosen, can resonate more deeply or more quickly. By doing so, they are more apparent than low potencies to stimulate healing aggravations, the body's responses to the healing stimuli. We recommend that potencies of 200C and certainly higher potencies should be the exclusive domain of licensed professionals and constitutional casework, as they should not be repeated often and their effects can be subtle and are not always measurable to the untrained eye. Subjective observations around selecting potency: the larger the number, the more times it has been diluted and suffused, struck or vigorously shaken. Generally, one potency is not stronger than another, but you may find one to be more appropriate for you than another, based upon subjective evaluation. When uncertain about which remedy and potency to choose, we tend to see lower potencies with more frequent dosing. Try any of 5, 6 or 7 ch. If you start low, increase potency with response. Decrease potency if no response, or switch remedy. Selecting a variety of selections will allow experimentation. They can be combined safely. Homeopathic practitioners recognize that there is a significant element of trial and error when it comes to selecting a remedy and potency for a given person or purpose, as textbook suggestions may or may not be right for each unique individual. The shotgun approach, trying several remedies and potencies at once, is a very common method which has led to the development of combination products and complex remedies. Many people subjectively find this very helpful and time-saving. Strict classical homeopaths disagree with this approach, preferring to find one constitutional remedy for the person, over several visits, deep history review and various remedy trials. There is no physical, chemical or scientific reason to suggest either approach is superior to the other. Loose trends we've noticed around potency selection: German-trained homeopaths in our region trend towards ch potencies. French or English-trained homeopaths in our region trend towards ch potencies. Historically, lower potencies were much more prominent. Recently, higher potencies, 30 and 200, seem to be more commonly requested. Locally, the most commonly requested potency is 30 ch. 15 and 200 would be second and third most common. Note: just remember, higher is not always better. Homeopathy's founder, Samuel Hahnemann, established homeopathic medicine by his success using potencies under 30x for most of his career. But everyone has their own opinion on this one. As a plan, we like to always leave somewhere to go, so it is best to start at the lowest potency that fits the problem, especially if the symptoms are mostly physical. Thanks for watching this video. If you want more videos like this, please subscribe to this channel and press the bell icon. Comment us your feedback. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.